everyone. Well, women have always paid more than men for health insurance, but a new guideline in Obamacare would change that. In 2014, insurers will be asked to charge the same premiums for men and for women. You like the story, won't you?
Let's see how it ends. Many argue since women's health costs are higher and they live longer, they should continue to pay more. Joining us right now, the person who's going to break the tie, the chairman of the urology at Lenox Hill Hospital, Dr. David Samani. Dr. Samani, women should pay more?
Look, it's not biased. I'm not saying this as a man, but I think that they are using the system a lot more than we are. So they go through a lot of preventive screening. They give birth. They have the whole mammogram, pap smears. Guys, you know, we don't like to go to doctors, right? You know, 70% of healthcare decisions are made by women. In my own practice, I see that it's the women that bring the guys and say, go get screened. Otherwise, you and I were never going to go to
Yeah, but shouldn't that earn us a discount? The basic fact that,
or a coupon.
That as women, we are responsible for getting our men to come to the doctor. And what about the fact that women, because they do all this preventative care, maybe their health issues end up costing less than men's who don't come to the doctor till it's a crisis and a big deal?
Yes, that's a good point, except that, you know, women live longer. You know, women live until like 81, and men only live up to 76. So we're using the healthcare system much less. You know, also, our body are completely different. You're more susceptible to stress fractures, to really other things. And you guys, women use the system a lot more, so it costs us a lot more. But I think, look, Brian, I think to fix this whole insurance companies and like healthcare system, you have to get the third payer party out of this. If you pay for it, that would be the way to go. We should all have some catastrophic insurance for hospitals, but when it comes to your CAT scans, X-ray, doctors, you have to come in with your credit card or cash and say, I'd like to see the doctor. That will take care of all of this stuff. By including men into this and make you pay as much as Gretchen is, that's not a really fair system. She sees her doctor all the time. When was the last time you went to see your doctor?
2 years ago.
Exactly. And you?
I've had Lyme disease for the last 10 days, so...
That's what happens.
Yeah,
so she's been using, you're basically paying for her.
Right.
Wait a minute. I paid for my Lyme disease appointments. I mean, right. I didn't call Brian and say, spot me 20.
No. Yeah. But based on the new system, they're trying to make everyone pay the same.
Pay the same, and it's not right, you're saying. Because in this case, it's not equal. Women are here longer. You have a better time on Earth than we do. You're here a lot more. You get yourself, you have 6 years of heaven.
They're healthier.
Where you just have no men around.
That's right. We only start seeing doctors. We go to our urologist at the age of 45 or 50.
Is this another example of this is equal, but it shouldn't be equal, is what you're saying?
I just think that the whole system is not working well. I mean, this is one of the examples where men and women are totally, there's a sex difference when it comes to the healthcare use. But I really think that if you pay for it, you're going to negotiate, finding out where is the best doctor, where are you going to get the better deal on all these x-rays, etc.
Right.
That's how you're going to save money.
Just one other quick point. For example, maternity costs that's one of the biggest costs,
Big
right?
time.
But men and women have babies together. So shouldn't men also...
Not always.
But shouldn't, just because the mom is now a single mom potentially, shouldn't the man also be responsible for those costs?
Look, there's no question that, you know, we are paying our own dues. There's no doubt about it. And I agree with you that it's a shared responsibility. But just the way the system are, in my field, we only have the prostate. Women have the breast, they have the ovaries, they have the uterus, they get checked in every part of it.
Eight extra
now it's a good time for you to come back.
1-800-GOD, can we change the organs of a woman so that she doesn't cost so much?
Hey, guys, we have to counter with some body parts. Yell them out. Come on, Scott.
Exactly.
Nothing? I didn't think so.
Did we get prostate?
No, but we started with prostate.
Exactly. Okay. But that comes later on. But we'll see how this is going to really pan out.
All right. This is one time in which Obamacare says everyone's equal when they really are not. All right. Thanks, Dr. Samani.
I protected you, Brian.
You did.
Yeah.
I gotta.
He did. Okay, coming up, the price you pay for guns and ammo about to skyrocket if Democrats apparently get their way.